بشكل انه مبين راس هي وراس هي انا وضبطش مع السكين. It is for what, this treatment?
I'm going for liver.
Liver. Acha. And what is his problem?
His problem is stomach pain.
Stomach pain. And he is under treatment from how long?
This is the first day.
First day. Acha. And just by this pressure, he will
Activate the that particular organ and activity. Now activating mucus blood.
mucus.
Mucus in the stomach.
Oh, this. What is the case of this patient? And And how long it take every session of treatment?
About 50 to 20 minutes, sometimes half an hour.
And how many session by week?
We normally give alternate days,
Alternate days.
roughly thrice a week.
Twice a week.
He is with you. Come inside. Sit.
Why? And how do you feel after treatment? Better.
It is come down.
Acha.
It was 8.1. Now it is come to 6. Report है. Show the
Yeah,
report.
so.
Can? Show the report.
And how many sessions you have? Acha.
Today is the 8th one. Eighth.
Eight.
You have come from where?
Lebanon.
अभी इसको पूरा report करता है.
This is the theorist report. Now.
You can show.
This now showed, no?
What is? Where is? Yeah.
This is last time. Hemoglobin and the creatine.
Acha. And what? This is new one.
Yes. No, this is the old one.
Old one.
Now new one is this.
What is the difference?
Creatine is 6.57.
Acha. Okay.
And the blood urea 150.
Acha. It was how much?
Before it was 185.
Urea. Blood urea. Acha.
You can come inside if you want. You want to come inside?
What?
If you want to come inside, stand this way. You have to take out your shoes if you want to come inside.
أكيد بغير بدي فوت معناها مرتاحة هون بتصير مرتاحة
illegal pain.
पेन नहीं है ना अभी पहले था 2 में आया था You have got any problem? Neck pain, back pain, shoulder pain, any pain? Knee
Back
pain?
and midfoot.
You got back pain?
Yeah. Huh? Yeah. Yeah, one midfoot.
संजय एक वाइट कार्ड दे उनको प्लेन ट्रीटमेंट लिख के ले लो
عنده دليل واحدة عنده دليل شو تعرف شو الدليل يعني كل الناس
طب مش هو عنده بس كمان سنتين
بس كلمتين جمعة
Dark or calm? What to calm?
Same. لا أنا لا.
مش هينفع إنه أي شيء تاني إذا أنت عندك بس لا
They teach you how to do for him? No?
They are coming from far away. They are coming from far away.
Malad? Sir, not too much far. Kunja pura.
1 hour then. 1 hour. 1 hour take to reach. 1.5 hour, 1:15.
By rickshaw, how long it takes?
It's also more. Next 1 hour according traffic.
Good girl.
بس ولا صوت حلوة الكاميرا حلوة صوتها طلع تفضل
كده क्या हो गया? हाँ
قدير قاعدة عند العشرة 600 قدير قاعدة عند العشرة
هذا
6000 ولا 600
كبير. بس أنا كبير. تخيل في بيتي كاميرا معي.
Baby, inside. Well, I get you. Yeah.
You get training, no?
You are busy. You're okay, huh? You're okay?
I'm not okay.
Not okay.
I have diabetes.
Diabetes is a good friend. Go for it. Diabetes is supposed to be a bad neighbor. You have to manage with the neighbors, you know.
टाइम आती है। This treatment is for the neck or also physio?
shoulder pain.
अच्छा।
Very common problem because we got very bad postures.
अच्छा।
Our sleeping postures are bad.
अच्छा।
We like to sleep like this. It's all rubbish. You always keep your hand free.
अच्छा।
But generally people like to sleep like this,
Yeah.
and like this.
Yeah.
The moment you put a hand like this and like this,
It's not
you're
good.
disturbing the functioning of the brain. It must be free. Hand must be free. That creates all sorts of problems, back pains and whatnot. How do you sleep? You sleep like this?
Keep it name it name है.
No.
But why like?
Never feel.
That's good.
Not good.
Keep the hand free.
Sleep straight.
It's better to sleep on side. There are three postures. Either you can sleep like this,
Yeah.
or you can sleep ulta, or you can sleep on side. Side is the best.
Are you off this?
Second is this.
अच्छा।
And worst is this one. He's definitely sick.
अच्छा।
Somebody is sleeping like this.
Yeah.
You can take it as granted he's sick.
अच्छा।
You are mad.
So this is for neck problem.
This one is not. अभी ठीक लगता है? चलो भाई आइए.
And
Come.
are you accent no?
Huh?
Are you accent no?
But here I have skin very sensitive.
Don't worry. I'll not do anything there. You got back pain, na?
Back and serious cough.
Cough problem.
अच्छा।
Okay. Don't worry.
Saura?
You have to take out your shirt.
और
Shirt and banian. And you sit down. Take rest.
No,
should we put off this also?
Done. Fully. Come over this. Just keep it just here. Fine. Sorry. हाँ हाँ खोलो. हाँ बोलो
Thank you.
जो Go up.
माझी परीक्षा येते
ना अभी आज कितना टाइम लगेगा मेरी से खाली दम निकलना दम का प्रॉब्लम है बाकी का सब अच्छा ये वाली तो लगती होगा
इसका मैं कार्ड देखता हूँ तब उनको कारण कुठे गेलं दिला ते
हे बघा इथे दिलंय
فهي الاسسمنت تبعه انا المره
संडास कसं आहे आई संडास कसं
ते आलो क्लिक
संडास कडक आहे मध्यम आहे इसका आई का ये हाथ जब मध्यम है ना पर वही थी दे दो स्टेपलर ये वायर में लग गया है उस वीर को कल कुछ दिया था उससे गरम किया
मैंने सुस्ती में नहीं किया था वही दिया था
उसे बुलाया कैसा लगा
लग रहा है अभी
जाओ
कल सुबह देखता हूँ
आ जाओ
دكتور مهرة is it possible last thing to make one interview for 10 minutes with you?
Yeah, possible you can have today.
Mehra, I want first to ask you after seeing your clinic and seeing this kind of treatment what you tell neurotherapy. So what is first neurotherapy?
You see, neurotherapy is natural way of treating the patient or treating the diseases. We are not using any kind of medicine. We are not giving any kind of medicine to the patients. But I want to explain you one thing. This is the ancient therapy of India, in which our ancient people, they were setting the navel.
Achha.
So I was also setting the navel of the patient.
Achha.
And during that period when I was setting it, I had all the control on all the glands of the body.
From the navel.
On the other glands, pancreas, liver, gallbladder, uterus, etc. I got my hold on that. When I was so successful, then I converted the same therapy, our old ancient therapy. Then I started studying the medical books like what do you say, Guyton or
allopathy.
All other I started studying those books. And in those books I found that pancreas is producing this chemical, particular chemical it is producing.
Yeah.
So I started mixing those chemicals, and then by the mixing formulas, I had made the medicines. With those medicine, I am treating the patient.
So we can consider that neurotherapy is your own discovery, or it's just reading in other way the ancient text?
No. That was only setting the navel only, nothing doing. But this is my own invention.
Your own
Now
invention.
it is not written in the books
Achha.
that by giving this treatment, acetylcholine will be produced in the body.
Yeah.
This is neurotransmitter. We
But
can produce acetylcholine. We can produce gamma aminobutyric acid. We can produce serotonin. We can produce dopamine. You ask any chemical, we can produce in the body.
You can produce by inner
by inner we know that if we will stimulate particular liver at this place, then heparin will be formed in the liver, because
Yeah.
the mucosa, 85% of the heparin produced in the body are produced by the mucosa of the liver and the mucosa of the
So if I have understood,
lungs.
The philosophy and the principles of your treatment is to let the body himself
Yeah.
secrete his own medicine and to cure himself
Yeah.
by his own secretion.
Secretions. But because of that, I started studying, because I had not any pathology department.
Acha.
So I was just setting the formulas and everything. But because of that formula, in that formula, I studied so many patients, because nearly 100 patients every day I was seeing it. So because of that experience, now I had come to know that if I will give 2 medulla, it means 2 times on the medulla. If I will stimulate, then GABA will be formed, means gamma aminobutyric acid. So likewise,
One question first, as a historical, from how long you have already started this kind of?
from the last 60 years,
60 years.
60, from the last 60 years, I am studying the books. I am doing practical job of
Originally, you
neurotherapy.
are MD doctor, allopathy.
You see, by the way, I am lucky that I am only matriculated. I am not studied anything, but alternative therapies, they had given me, you may say, honor, give me the honor for that by giving MD, etc., MD, etc. ND I had given the exam.
Because we see here you are MD.
Yeah, MD is given by Meher Master Moose.
Acha.
She knows me. She came here. I had tried to cure her also.
Acha.
She was feeling better, and then in the World Congress, she gave me honor for by giving MD, because she knew that I know medicines very well. Likewise.
I want to ask you one practical question. We just show the people how you treat by neurotherapy. So we see this therapist who is pressing by feet and
Yes,
hand.
you see-
So what is the what is the purpose of this pressing, and what is in comparison of acupressure or acupuncture? Is there
Yes,
some
this is not acupressure. Acupressure is separate, acupuncture is separate. But we are not treating with hands. We are standing on the patient's body.
but sometimes he treat with hand.
Yeah.
Basically he treat with
Because of we want to stop sometimes we want to stop the flow of the blood, so that the opposite direction the flow will be more. Suppose we are standing over here, the more flow of the blood will be on the pancreas.
Acha.
So that's why if there is any blockage or some type of problem in the pancreas and more flow of the blood will be there, it will be opened and it will be all right.
My practical question, just by feet, how the therapist can master the pressure, because we know that by hand maybe we can master better.
You see, it is not like that. We had give them practical training too much. But each and everybody should stay. We had got particular time of 6 seconds. Each and every therapist should stay there for 6 seconds.
6 seconds.
There is no question of weight. Either you are 70 kg or the other is 35 kg. It makes no difference. He should stay there. The therapist should stay on the patient for 6 seconds every time by giving the stimulation. That's why each and everywhere, whatsoever it is. Now you see, you are preparing mutton or what you say, dal.
Yeah.
If you are preparing dal, you give 6 ladies and ask them, this is dal. You understand now?
Yeah.
Now this is dal, this is salt, this everything is here. Each and every lady should take dal from here.
Achha.
You ask them to cook it. So each and every lady will cook that dal. But is the taste will be same?
No.
No, taste, the difference will be in the taste,
Yeah.
but not in the proteins.
Acha.
There will be the same proteins whatsoever in this dal, whatsoever in that dal. Though there will not be any difference in the proteins. Taste may be difference. Likewise, there may be 70 kg, the other person may be 35 kg. It makes no difference, but the result will come same.
Okay. One other practical question. For what you use powder? What is the purpose of using
No, it is talcum powder because smoothness. When
Only.
we are rubbing some places, the smoothness should be there. My son, he is not using any type of powder. We are using powder because he is. There are only 3 or 4, or 5 therapists are with him. But now we have got 2,000 therapists all over India.
Yeah.
Now they are giving. So I want that everywhere one smoothness and
But
one thing should be.
There is no risk of contamination from one patient to other. Suppose this therapist is treating one patient by his feet, and after if he treats other one, there is no
Still,
risk of.
No, it is, you see, we are, I mean to say, actually we are making the immunity of the patient.
Yeah, but
You
just
see,
by transmitting
that
from,
is, I
from
don't
feet,
think,
his own
you
feet.
see, we had never tried it also, but I don't think so, because we are using powder. So I had never.
It's sufficient this powder to.
That
to
is
prevent-
not insecticide, it is ordinary talcum powder.
Acha.
That is by giving some scent, they are putting some scent or something in the powder, same powder we are using.
And
Yes.
do you so work in the nadis in some special transmitters system in the body, or it's only physiological?
No, it is the physiology. We
There
are
is
studying
nothing to
from
do
the
with-
we are studying from the Guyton, Harrison, or the other medicine books. Not only one. We are studying so many books. But so many books, then we are making one summary of all the things. Then we teach the same thing to our therapist. Within 45 days, he will be ready to give to. He knows so much. I mean to say, very much he knows about the physiology of the body within 45 days. I have got one ashram over here. It
Yeah.
is one ashram. There, the students are staying there only 24 hours. So 8 hours lectures are there every day. But our lectures are so simple that uneducated person, I told you that I am only matriculate. And this is very good for me because I did not know the meaning of the words. To learn the meaning of the words, I will have to study more. So I had got so many dictionaries, so many books, so that the meaning of that particular part should come in my brain.
You have already told us that the function and the philosophy of this treatment is to let the body secrete by himself
Yeah.
something. Is it this pressure by feet sufficient and enough to let the body
You
secrete
see,
this kind of...
sometime I told you, sometime we are stimulating the particular gland 2 times, the other time it is 4 times, the other time it is 8 times, the other time it is 10 times. Every time they will produce, the gland will produce separate chemical. It is not the same chemical it will. By giving one stimulation, you see, now you see. You are phoning,
Yeah.
the figures are from 1 to 0. If you want to run 2, you give 2 only.
Yeah.
So it will go to the 2 number. It is 8, it will go to the 8 numbers. Likewise, we are stimulating the glands. So I want this particular chemical. I want now in pancreas, I want that insulin should come out. Then insulin will be out
But
from the
here,
pancreas.
is there some risk of mistake if this therapy, instead of stimulating this gland, he stimulates other gland? There is no risk of mistake. And
No, there is not. It cannot be. When we are stimulating pancreas, the pancreas will be stimulated, not the other gland, because from the last 60 years, I had done the practical on lakhs and lakhs of the people.
Acha.
And the practical is very good, and I am very much successful. On the whole, you will How can I explain you? Not even a single patient has come to me that you had worsened me. Because there is no side effect.
No side
of
effect
our-
at all?
No. Because there is one thing very, I don't know that you know physiology or not.
Little bit.
Little bit. Now you understand, just understand one thing. Pituitary gland is producing so many hormones, but they are producing in large quantity. Suppose during the period when he had produced TSH for thyroid gland, those hormones had been produced, then thyroid gland becomes satisfied. Now he does not need more TSH. Then immediately by feedback system, it is asking the pituitary gland that you stop this producing this particular TSH because don't require more. Now he had produced already so many hormones which are there in the blood, in the transport.
Yeah.
So when those hormones which are produced already, when they will go in the liver, the Kapha cell will finish them. So this is the main thing to the neurotherapy, that there will not be any kind of side effect of our chemicals.
Which kind of diseases you are treating?
I think so the worst part is AIDS.
AIDS?
Yes, we are treating AIDS and the patients are very good.
You get good results with AIDS?
I say when allopathy is coming to us, they are asking how many you have cured the person. I say that now from the last 45 years the people are having insulin. Are they cured? No, they will have to take the medicine. Likewise, when they are asking us question, so it is very difficult. Now I had cured 100%, one patient has been cured for motor neuron. Now when we say that no, show us at least
one case.
200 patients of motor neuron, but there are only 20 motor neuron patients. There are not more than 200 or 300 or 400 patients in Bombay, or you may say India, more than 300 there. I don't think so.
Which kind other than, which kind, in brief, which kind of other diseases
Now
you
I
are
showed
treating?
you one muscular dystrophy.
Yeah.
I have got more than 200 patients of muscular dystrophy, and all are very good. And on the other side, we are teaching the kith and kin or relatives, mother or father of the patient, that you start giving this particular type of treatment to the child and he will be okay. They are giving.
And all your treatment is without any other medicines?
We are not using any kind of medicine. But if they are taking, I ask them that don't take this medicine.
Don't take.
If I ask them,
Yeah.
even they will not stop it. Because this is WHO had washed the brain of the doctors and doctors had washed the brain of the patient. That without allopathy you are nowhere.
So they can follow their own medicine?
Yes, I don't, because of the last so many years experience, I know that if you will stop them, even then they will not stop the medicine. Why should I stop it? I want to cure the patient. I don't ask the people that you should know that I had cured it. I am not interested. I want to cure the patient only.
But
I don't want.
So you think and you believe and you, according to your own experience, that this neurotherapy is sufficient to cure such diseases like AIDS, like
You see,
all
we
these
are
cases?
curing. I have got so many patients. I can show you. From the morning I had showed you.